my face. Okay, so just in general, those first questions, the first questions we always, always, always assess. So whether that is community organization, whether it's working in your agency, you always, always assess. So again, if I had a headache and I went to the doctor and he gave me like 40 milligrams of hydros, hey, great, right? However, that is not assessing. Find out what's going on with me. Ask me some questions. Don't give me any medication. Don't refer me out until you've asked me a few questions. So those are always important to assess. If I walk into my doctor's office and I am bawling, if he just continues like I'm not even noticing me, I'm going to be upset. Be sure that you answer the emotion questions with emotion. If the vignette shows that someone is sitting in front of you and they are crying or they've called, they're extremely distraught, we have to acknowledge their feelings. Okay, so acknowledge the feelings, assess, 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 assess before action. There are a lot of acronyms out there, and certainly please use whatever works for you. I'm not a real fan of all the acronyms. I get lost after like the first three. So the simple ones are if it's a safety issue, if someone's in imminent danger, and it has to be imminent, like they're going to go home and kill themselves right away, imminent danger, then of course we're going to do something. Okay, calling the parent of a child is not doing anything. Calling the parent after you've called someone else or calling the parent to inform them that you're going to do something, that's an action. If the parent does not take the child, then you're still responsible. So our duty is to the client, and that client is the child at that point if it's one of those type of questions. Okay. So again, I can almost say it over and over again, assess before action, assess before action, assess before action. That doesn't help with those content-based questions though. So what I get is a lot of students will tell me that they use that same technique with all of the questions and it didn't work. It's not supposed to work with all of them. Some of them are just content. You have to know them, you have to know them. Read the Code of Ethics. Read it, read it, read it, read it, read it. Some of those questions are verbatim from the Code of Ethics, okay? There's the one, and if you've had me before, the one about whether or not you can sleep with your client. The Code of Ethics clearly states that you cannot have a relationship with an ongoing client, okay? However, it does not clearly state that you can't have a relationship with a former client or a client's relative. Let me pull up those Code of Ethics really quick. Let's look at those. Actually, I don't want that one yet. Okay, and again, you can Google a copy. I'll gladly get you a copy in the text box. But this is just a copy of the Code of Ethics. This is what we live and die by. There's always a question about maybe some of the core values. What are our core values? And there they are: service, social service, dignity, worth of the person, importance, all that good stuff. Those are my codes, and I bet I'm not screen sharing. Sorry, let me go back. Okay, now I'm screen sharing. There we go. Okay, so my Code of Ethics. Okay, and again, so those are, we see that all the time, those questions. What are our core values? Service, social justice, dignity, and worth of the person, importance of human relationships, integrity, and competence. So know those terms. Those are things that the core value of what our beliefs are. Okay, and then in general, we'll talk about some of the codes. And I'm not going to go over all of these today, but again, read them, read them, read them. Okay. So when it comes to the standards, these are ones that were, again, those the vignettes. So if you're reading the vignette and it talks about something that's a code of ethic, you have to know what the code says to match it. Okay. So our ethical relationship is to our clients. So even when it comes down to the question was regarding can we picket or our social values, social political views, we can, as long as it doesn't interfere with the client. That 1.02 self-determination, remember that a client who is in a psychotic episode, confused, delusional, they have lost that right to self-determination. You cannot let a 20-year-old homeless woman who is having hallucinations, you cannot leave her alone and make her own choices. She's not capable of that because she is obviously not functioning as she should. Okay. And again, I'm not going to go over all of these. I'm just going to pick out some important ones when we talked about our clients. Okay, this is a biggie. I see this a lot also, access to records. So the truth is that if a client asks for their records, many times we say, oh, you can have them as long as you're not in danger. That is true, as long as they're over 18 and we have no reason to think they're going to hurt themselves or there's anything unethical in those papers. You can have them. Come by the office, pick them up. You actually have a right to charge if you want to. If you make copies, you can actually charge. That is not a problem. However, if you are concerned about the client's access to his records and you think that could seriously, he could misunderstand them or cause harm to them, then you're going to provide assistance in interpreting the records. What that most often looks like in the question is, schedule an appointment, come on in, and we'll talk about what's in your record. Okay, so that's just, I'm still giving it to him, but I really just want him to understand or understand what was going on at the time or why I wrote that. However, if in exceptional circumstances, when there's compelling evidence and that access would seriously cause harm to the client, then I am not going to give them. I'm either going to withhold them or limit part of them. Okay, so remember that. I'm going to limit part of those to that client. And of course, I'm going to document. If I don't document, it didn't happen. You will know that. Okay, so my sexual relationships, I pointed this out a couple times. So under no circumstances can I engage in sexual activity with a client. Never, 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 never. I can't send them text pictures. I can't send them, I can't text them and anything inappropriate. I cannot. However, I should not engage in sexual activity or contact with the client's relatives. It does not say I cannot. So the question might say, can you do that? No, 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 no. Okay, you cannot. So, I'm sorry, wait, let me try that again. So, can you on that one? Yes, you can. The client, you cannot. The client's relative or former client, if you so choose, it is up to you, and you have to be in a personal relationship. It has, if it has the potential to be harmful, then it's all on you. So I've seen that question on there. Can you have relationships with a former partner or with a partner's former client's cousin, neighbor, etc.? And actually, you can. So that you do have to, again, make sure that you are personally responsible for that, not the client. So that is not an absolute no on that one. Okay, there's a couple others we'll talk about later, but I just want to make sure that you know to read those, read those, read those. Know them, know them, know them. Okay, questions, anybody? I'm going to try to keep my chat box up. Is there a statute of limitations? There is not. So in some of the other professions, there is. So if we look at like the the psychologist, it says 7 years. Doctors say 7 years. We do not. There's not a number for us. It just says we're totally responsible. Is that a question? Okay, so I'm going to pull up a couple of questions. These are just old tests that I use. Okay.
Get up.
Okay. And again, you do not have to answer out loud. I would like for you to answer in the chat box, please. And as you answer in the chat box, if you have any questions, just if you don't understand why the answer is the answer, we're really good with that. Okay. I'm going to go. Okay. So I'm going to start with 99. And those of you who've taken the test before, if you've seen this question or something like that before, be sure that you let us know, because that gives my newbies a time to kind of know what to look for on the test. Okay, and again, just chat in that chat box. So number 99, I've got Luke. Luke is a gay male. He is HIV positive, and he is often seen at a community health center. Luke was in graduate school through his mid-20s. Okay. He was in graduate school through his mid-20s, and after graduation worked for a year before ill health caused him to resign from his job. He is still intermittently deeply fatigued and ill. And therefore, he cannot commit to a new job. The health center caseworker refers Luke to the Social Security Administration for what federal income benefit? You can't really hear me. My volume is up. Does anyone else can't hear me? I can move my mic closer to my face. Tell me if you can't hear me. Yes? Okay, I'm not seeing any text or type, so if you can't hear me, just let me know. Okay, you can hear me. Okay, so if you can't hear me, it might be on your end. You can always turn your volume up, or you can hover over. There's one that says audio and video, and you can make sure your volume is turned up. Okay. Okay, I can't go any louder. So the health case worker refers Luke to the Social Security office for what federal income benefit? So he's going to get SSI, SSDI, Social Security, or Medicare. And if you could chime in, 1, 2, 3, or 4, tell me what you think. You can tell me or you can chime in. Either way, type it in or chime in. I'm not seeing any answers pop up. I'm waiting for my phone to ding. Come on, come on. I got somebody. I got a 1. I got a 1. Okay, come on. You can hear me. You can hear you beep. Okie dokie. Does anyone know the difference between any of those, the SSDI, the SSI, and Social Security?
No.
Okay, so those are our federally funded programs. So Social Supplemental Security income is what I would get if I were older, and I'm just going to pull for you. Okay. Okay, so then here are the rules. So my SSI is Social Security income. I will get that if I'm 65 or older, blind or disabled, income restricted. And then after that, I'm on that, I get Medicaid. My SSDI is based on my work history, and this is what I get if I get a disability check. Okay, so that's what you most often hear is people say they get a disability check. I think most parts of the country comes about the 3rd of the month. So I work in a rural part of Georgia. So my clients or my families will sometimes call it your crazy check. You know, your crazy check is coming. So if you've been
finish your work,
you can get a crazy check. Okay, that's SSDI. That is my Social Security disability. Okay, now is that pretty clear what the difference is on those? So SSI I would get if I'm 65, I've retired or I'm blind, and I did not necessarily put any money in. I'll still get a little bit out. Okay, but it's very restrictive based on my income, and I'll get Medicare, which is state health insurance. My SSDI, that amount fluctuates depending on how much time I spent working. Okay, so if I've worked a lot, then I've paid in a lot, then I'm going to get back. Your SSDI would also, in the event of your death, that is the same thing that would give your children and the spouse, if you're married for at least 10 years, that would also kind of give them income if you were disabled. So a person who gets SSDI, their children also will then get a check because they're not capable of paying child support. It comes out of that same SSDI amount, but they would get child support based from some of the government. I'm sorry, they would get Social Security in lieu of child support because dad can't work. Okay, so then, does that change our opinion of what that answer might be? Let's go back to that. Okay, so those are my direct questions. I'm sorry, my indirect practice. So those are sometimes the ones that give people a really hard time. So now that we know he's fatigued and ill and he cannot commit to a job, so he should apply for what? Yes, he should apply for the disability income. Okay.
Mhm.
And again, feel free to type in, asking questions. That's what I'm here for. 100. Jared's partner of 5 years, Daryl, died 5 months ago of complications to AIDS. Jared meets for the first time with a social worker at the health center where Daryl got his care. Jared tells the social worker that his friends are urging him to date again. They say that by this time, he should be ready to get on with his life. Jared wonders if something is wrong with him. He is keeping up with his work, eating and sleeping all night, and going on hikes occasionally with his outdoor club. But he still misses Daryl very much. Okay. You want to mute your mic for me? See who that is. I can mute your mic. Okay. If you just hit your mute button, it'll mute your mic. Okay. So then, Jared wonders if something is wrong with him. But he still misses Daryl very much. He cannot imagine getting involved now with someone new. He will not consider dating. The social worker's best intervention. A best question means that one of those can be more than okay. So I'm looking for the best answer. However, so A, am I going to recommend counseling for depression? 2, normalize Jared's grief and support his grieving at his own pace. 2, recommend an evaluation for antidepressant medications. Or 4, to agree with Jared's friends that dating might be a good idea to help him resolve his grief. Okay, so 1, 2, 3, or 4. Chime in and tell me what you think. Got a 2.
Okay.
Come on, share your thoughts.
I think it'll be 2.
I got a 2. 2 2s. Anybody else? Okay, so can you tell me what in the question tells me that 2 is correct? What line? And that's what you always want to do is if it's true and it's a vignette, go back to the test and say, well, how do I know that? So what do you see in there that makes that so?
I mean, he says that he's keeping up with his work. He's eating and sleeping all night, and he goes on hikes occasionally with outdoor club.
Okay, so we're not seeing him like grief-stricken that he can't get up and can't do anything, right?
Right.
Okay, so to recommend counseling for depression, am I seeing any signs of depression? No. Number 3, to recommend an evaluation for antidepressant medication. No, I don't think that would, and he may be depressed. I'm not seeing anything in the question that supports that though. So number 4, to agree with Jared's friends that dating might be a good idea for him. I mean, it might be a good idea, but in the question, do I see anything to support that? And no, so the answer is 2. Okay, so that's really kind of how I want you to answer the vignettes. If it's the first question, of course, those are a lot easier, but at best, go through, look at the 2 that are absolutely no way, and the others that are 2 that are close. If none of those make sense, you missed something in the question. Go back and reread the question. They're really not trying to trick you. They're trying to make sure that you have read the question and that your critical thinking skills. What they're trying to prove, this test is saying that you can think critically outside the box. So even though there are rules, they want to know if you've got a client sitting in front of you, do you have enough skills to make that decision? And that's critical. Those are critical thinking skills. Okay. So then, 101, Susan, a social worker at EAP, that's an Employee Assistance Program. If you're not sure, most agencies have one of those. You get 2, 3, a few sessions free of charge. It's part of a benefit packet that your program has bought for you. If you're still a college student or recently graduated, the EAP, the colleges also have that. So it's not someone on campus, it's usually someone who's contracted out, but you kind of go and you spend some time with them to work on some of your issues, like 3 or 4 sessions, usually for free for students, but the same for staff. So one of their clients is the town fire department. 2 days ago, a fire chief had a heart attack in the station in the presence of other firefighters. 2 firefighters attempted CPR while someone else called the EMTs. Despite their best effort and those of the EMTs, the chief died. The assistant fire chief contacted Susan, saying that he and his crew needed help dealing with their feelings about this terrible event. Susan saying that so some firefighters found it hard to return to the station. Others who did come to work were preoccupied with the loss, a sense of helplessness and guilt that they had failed our chief. Susan arranged for a team of EAP workers to meet with the crew in groups to help them manage their reaction and to try to move on. This form of group intervention following a trauma is what? Is that 1, mandated care, 2, critical incident debriefing, 3, group therapy, or 4, managed care? What is that? 1, 2, 3, or 4? I need some beeps in.
Can you go over that question again?
I sure can. Do we read it again?
Yes.
Okay. So it's Susan. She's the EAP worker, and their client, one of their clients is the fire department. Okay. So the fire chief, he had a heart attack in front of his people. It's like he's at work one day and he suddenly has a heart attack. Now firefighters, of course, they're all trained for CPR, so they all did their very best. However, they could not revive him, and he died. So the assistant fire person called Susan and said, "Hey, wait a minute, the crew's having a really hard time. He died here at work." So some of them found it hard to return to the station. Some of them felt they were all preoccupied, and they felt really guilty. They had failed their chief. So then, what kind of group intervention? When something happens, and we go over and as a group, we kind of work on helping the clients. What would that be? And the answer is 2. So those who chimed in, that is 2. That's critical incident debriefing. Okay, so that is exactly what you do. So I'm going to go over just to remind you, many of you have had this already, but I'm going to remind you just of the way that we treat crisis and the steps for that. So this one came about after 9/11, and so if you went to school, it probably became famous about 2005, 2006. So if you went to school before then, you might not be as familiar with it. But these are the steps of crisis, and many times we are not familiar with that. You have a question about mandated care and the last choice. Give me 1 second, and I'll go over this and I'll go over that. Okay. My computer's being very slow, probably because I have so many windows open. Okay, so this is Robert's, and these are his 7 stages. So for many social workers, this is a very foreign concept because this is the way it works, and we're not used to that. We're used to coming in and dealing with feelings first. So when there is a crisis, and so this one, what the question was is a critical incident debriefing, and it happened afterward. So you use this image, this model, when you're actually in a crisis. So if you've been called to a crisis call, whether it's a school shooting or someone individual, this is the crisis model that we use. So the first thing you're going to do is plan and conduct a crisis biopsychological assessment. I'm looking around to make sure everybody's safe and no one is in danger. Okay, that's the first thing. Biopsychosocial, look around, check people, look for everybody. We want to make sure that shooter's not on the loose. We want to make sure the person that we're coming to see is not still ready to kill me. Make sure that we are all safe. Before I do anything, make sure we're safe. So 2, establish rapport and quickly establish rapport. So I see myself as, people have got their hands up coming out of the building and they're trying to make sure that we know who they are. So then the last straw. So whether it's, we're going to ask people, do you know what happened last? Or can you tell the last thing he remembered before Johnny showed up to school? What was he saying? I'm trying to get the last straw, whether it's a group or an individual. What happened? It is not until step 4 that I actually explore their feelings. How are you feeling? I imagine you're scared. Validation. Step 5, I'm going to look at explore alternative coping strategies. Many times I'm going to look with what they've used before to get through their crisis, and then develop and formulate an action plan, and of course follow up. This is my critical incident training. Okay, so this is what we use. So if the question talks about a crisis and talks about steps, these are the steps that we most often are going to use. Okay, and I'm going to put these in the chat box. Switch my screens back. Okay. There we go. There we go. Okay, so I'm going to go back to the questions and ask. Okay, so you ask me managed care and mandated care. Okay. So mandated care really is not a term. No one's mandated for care. They might be temporarily if they're court ordered for a few hours or 48 hours. They might be a little bit, but that's not a normal term that we would use as mandated care. So then the managed care, if you asked, I think that's what you asked me, managed care are by HMOs. So back in the day, if you haven't practiced for a long time, back in the day, what used to happen is we didn't have any managed care. If you had Blue Cross Blue Shield, if you had even Medicare through Social Security, Medicaid, then I could just bill you and treat you. My reasonable and customary was about $150 an hour, and I could just charge you with very little oversight from the insurance company or from the government. So now we have HMOs or PPOs or any of those things. Those are called my managed care things. And managed care really is there's a case manager who is looking over the case, watching how you spend those dollars. It's the same thing as when you have a doctor. So if you go to a doctor's office and he has to justify why he is treating you. Okay, I will tell you, once you get your license, managed care pays very, very well. If you work for like Unum or Blue Cross Blue Shield, any of those big insurance companies, you get paid very well, and many times those are from at home as well. You are really you're the gatekeeper of who pays what it gets paid. It's called utilization review or utilization management. Okay, so the same way when your doctor goes in and your doctor says you have an upper respiratory infection, do this, this, and this, or if you're going to have a major surgery, he has to get pre-approval. That's the exact same way it works in mental health. So when you call and you say you need a provider, the provider has to go through your managed healthcare people to justify why you're getting this treatment. Okay. Also, there may be a question on there about what you can release to the managed healthcare or the utilization review people. So most often in most agencies, when you come in, you've already signed a release. The doctor will say something or the therapist will say something, and this is how you get paid. You're allowing your insurance company for us to share your diagnosis with the insurance company. Most often, that's all they want is the diagnosis. However, you may get a call from them saying, hey, I see you're treating Sally for something. And I'm wondering if you can tell me a little bit more about this. Because you're asking for more time, more sessions, something different. They want to know why. So a question might be ethically, then what do you do? So what I'm going to do is I am going to say to them, let me talk to Sally first. Okay, because yes, her insurance company has to know the diagnosis, and that's something she signed already. But before I share any more information, I'm going to talk to Sally. Now, if Sally wants to continue with me, she's going to have to let me share with the insurance company, or she can be a private pay client. That's really up to her. But I'm going to give her that choice because that's the way managed healthcare works. Okay, is that new? Have you guys heard that before?
Not really.
Okay, that's one of those the indirect coverage. Okay, so that is what that is. And when I go back to them, because they work for because you work for private pay, you're working for profit, Blue Cross Blue Shield, Unums, whatever those big companies are, those are for-profit agencies. That's why the pay is so well. So, we're talking like, you're starting out in the high with your master's degree. and a license, but they pay just really, really well. Okay. So then we're going to look at 102. These are some defense mechanisms. Mindy's second husband was emotionally distant for a year, coming home late from work without calling and no longer taking interest in any projects around the house. Mindy is a timid woman who avoids confrontation. So when her husband announced he wanted a divorce, she accepted his decision without expressing much emotion, telling herself he had already been absent for some time. Now, Mindy calls Norma, a social worker she had met for supporting counseling when her father died 2 years ago. In session with Norma, Mindy was low-key about the pending divorce, which also, sorry, making sure I get these. Okay. Let's see. So she was, excuse me, Mindy then called Norma, a social worker whom she'd met for supportive counseling when her father died 2 years before. In sessions with Norma, Mindy was low-key about the pending divorce, while also managing realistic changes in a sensible way, such as looking for an affordable apartment, while also looking at reducing her credit card debt. 2 months after the separation, Mindy came to Norma's office and burst into tears for the first time. She had gone to her old house to pick up a recipe book and was enthusiastically greeted at the door by her dog, who remained with her husband. Mindy found herself bereft at the loss of the dog, who had been crying since and has been crying since. Mindy's emotional reaction to the dog is an example of what ego defense? The way that she cried when she saw the dog. What is that? Projection, displacement, isolation of effect, or rationalization? We hear some chiming. I got a 2. Okay. So what do you think that one is? That is displacement. Okay, questions? Who's she really upset with? The husband. She's hurt. She's hurt. She's hurt. Her divorce, and she handled it so fine. And then she comes home and she cries, like, "Oh my gosh, it's my husband." It's displacement. So all of those defenses really should have been taken on the husband, but that wasn't safe, or she wasn't ready. Displacement is when I take those feelings that I put them on somebody else, basically. And again, I can recall vividly doing that. I have 3 children, and have you ever been, if you're a parent or you have animals, have you ever been mad at one of the children and take it out on the other one who didn't even deserve it? So I've got 3, and sometimes one of them would just tick me off, and the little one would ask me a question, and I'm like, ah, ah, ah. It wasn't her that I was mad at. She was just the easier target. So I think we're all guilty of displacement. Okay. Let's see how much you know about your testing. 103. Hannah is a clinical social worker in a multidisciplinary outpatient psychiatric service. She has met 3 times with Drew, a 20-year-old whose primary symptoms is depression, and his history reveals an inability to stick with a job or training program. Hannah suspects that Drew may be experiencing some psychotic thinking and that his troubles are not entirely accounted for by the diagnosis of depression. She refers Drew for psychological testing to help her make an assessment and a differential diagnosis. She hopes that testing will identify whether Drew has a thought disorder. What test would you give to answer Hannah's question? My Myers-Briggs, 2, my WISC, 3, my WACE, 4, my TAT, and Rorschach. Which would I give? I'm looking for their thought disorder. What might? Let me hear some chiming in. I got a not one. Okay, I would not give not one. That is correct. Myers-Briggs is my MBTI, and that was developed by Carl Jung. We use it now a lot with marital counseling and things like that. I suggest you can download a free one. So if you're in a relationship, even with your kids, it kind of lets you know like who you are compared to what they are. So it really looks at who you are, what your type is. That's your MBTI, Myers-Briggs. Okay, it's a personality test. So are you extroverted, introverted, sensing, intuition, thinking, feeling, judging, perceiving? And you actually get this combination of who you are. So it helps you understand who you are. And then with your spouse or with your children, you understand how different they are. And it's supposed to kind of improve those relationships. Okay. So that's my MBTI, my Myers-Briggs. Okay. So we know it's not that one. Okay. Did I hear another chime in? If it's not one, it's got to be something. Give it your best shot. Come on. I've got a 4. 4 is correct. You want to share why it's 4, Tamika?
I just took a guess. I did process of elimination actually.
Okay.
I knew it wasn't one, and those two, the 2 and 3. I think it didn't feel like that was the answer, so I just really did process of elimination on that one.
You did good. You did good. Okay. So Myers-Briggs is my personality. WISC is my Wechsler's intelligence scale for children. My WISC is my C. My WACE is my intelligence test for adults.
Yeah.
And the other one is that there's a WIPSI, WIPPSI. That's an intelligence test for preschoolers. Okay, so those are all intelligence scales, and an average intelligence is 100. The standard deviation is between 109 and 110, 109, sorry, 91 and 109. So that's an average IQ. That's what those two would address. The others are the TAT and the Rorschach. So Rachel, what's my TAT? Are you there, Rachel?
So yeah, I had my microphone off. Sorry.
Okay. What's my TAT?
Thematic
appreciation test. That's
Yep.
exactly what it is. Mathematic appreciation test. So these are projectives, and they are from Freud or any kind of psychoanalytic person. What Freud would do is he would say, look at this picture and tell me what you think. And then you would describe to him what you thought, and then he would tell you exactly what that actually meant. So that's a TAT, a thematic appreciation test. So of all those tests, that would be the one to use for looking for some pathological or from some not quite correct thinking, some cognitive issues there. The other one, I'm sure you know, that's the Rorschach. That is the test. That is the test that looks like the butterflies. You have to tell what it meant, and then you go from there. So those were the Rorschach, and Freud would say, look at that and tell me what that means.
So this is a recall question, right? This is a question that you have to know, right?
That is correct. That is absolutely correct. You should know all 3 of those. Okay, so I remember projectives because it's like a projection screen. So with Freud, so in psychoanalytic and psychodynamic, those terms are used interchangeably. Psychoanalytic is what we used to do. We lay on the couch forever. And then when we kind of looked at managed healthcare of what they would pay for, we changed it to psychodynamic. And that makes it shorter and sweeter. So that's psychodynamic is what we use now. But they're both based on psychoanalytic theory, which was Freud or Jung, who believed that everything was in the unconscious. Okay, that's where our id or all those things that come from. That is what Freud believed. So this is truly a knowledge question. So we've got to know is what those mean. Okay, so let me look at his theory. I don't want his development theory. I want his. Okay. So Freud believed that everything was in the unconscious, most everything. Okay. And what the therapist's job to do was to bring the unconscious to the conscious. So he believed that our id, ego, and superego were still all under the unconscious. Okay, and using a projectile test such as the TAT or the Rorschach, then he would bring this stuff up from the conscious to the conscious. Okay, so that the question is what was a psychodynamic or psychoanalytic, what was their goal? Is to bring it, you were unaware of it, you didn't know, and let me fix it. Okay.
So you said psychodynamic is like short term, basically?
So for the test, they're used the same, psychodynamic and psychoanalytic, and it's not a short-term therapy, it's just shorter than psychoanalytic. Okay, so it would not be considered a short-term therapy, no.
So I'm just not clear of the difference between the both of them.
And for the test, they're interchangeable.
Okay.
So for the test, we use them the same. So we don't use the term psychoanalytic anymore because insurances won't pay for it. We don't use it in a current theory. However, when we're studying it, we'll talk about psychoanalytic theory. But the way it looks now is called psychodynamic.
Okay.
But for the test, they're the same.
Okay.
Okay. And again, all unconscious. He believed that all of our defense mechanisms were unconscious except which one? Or does anybody know?
Nope.
Suppression. Repression is something that you choose to, I'm sorry, repression is something you don't remember. You have no idea of, according to Freud, all deep down. Suppression is a choice. So the question might be, you know, Johnny is 69, and when he was 12, he was molested by his priest. I'm going to go with there, but refuses to deal with it. That is suppression. He knows it's there, but he's not going to deal with it. But it's still a defense mechanism. The other one is repression, and repression is, yes, I'm aware that it's there. I'm not aware that it's there. Okay. So then my ego and my id, somebody want to explain those to me? How do they work?
Well, the id is the most, I guess, most like instinctual drive. Mm-hmm. And then, I see it. The ego is kind of like the regulator, or the superego is the regulator.
Got it. My id is my desires. I want. According to Freud, those were our instincts, our deepest desires. They were my pleasure principle. Yes. Okay. If you're old enough to know Janet Jackson, my pleasure principle. Oh, my ids are my wants. I got it. My eat, sleep, and procreate. That's what Freud said. Okay. And then my superego says, no, you can't do any of those things. And my ego finds a way for us to work it out. Okay. All of those are unconscious. However, then there were some things in our preconscious that we could work on to be brought up if we didn't necessarily need therapy for that. That would be like your first phone number. You know, maybe your the birth of your first child, your grandmother's, 90th birthday, any of those things that are kind of in there, but you can bring them up by yourself, according to Freud. Okay. While we're here, I'm going to just go over a couple of those defense mechanisms. Let me do one more thing. So on my question this week, if you're on my Facebook page, the word tripartite was on there, this word. Okay. It means three. Id, ego, and superego. If you've ever seen that on the test, that's what it means. That's a Freudian term. Okay. So then, throw out some defense mechanisms for me. Tell me what they are.
Sublimation is one of them.
What is sublimation?
I believe it's when you try to direct unhealthy behavior into positive behavior.
You're right. Can you give me an example?
I guess if you're stressed out, you might go to the gym and punch a punching bag instead of punching somebody.
Okay. He would probably say that's more displacement because you're displacing that anger on somebody else, I think.
Okay.
Okay. So I'm just going to break a copy of them. Okay, verbal brain. So sublimation is more of when I can find a more appropriate way to share my feelings. So for example, and what Freud would say is, I am really, I like killing things. I have a knife and I like killing and shooting things. So then I would find a job maybe as a butcher. Okay, because what I'm feeling is so inappropriate, I would have to find a different way to share it.
Mm-hmm.
Does that make sense?
Yeah.
Okay, so sublimation is I am, again, if you're old enough to remember, so there used to be a time where we thought if you played like the albums backwards, there was a subliminal message. Anybody remember that? Anybody know what albums are? Okay, so we used to think that if you played them backwards, there was like a message hidden, okay? So that's sublimation. So that is sublimation. It is underneath and inappropriate to share, so I just really can't do it. So I'm going to find a way that's more appropriate for these feelings that are inappropriate. Okay? So I got reaction formation. What's that? Give me an example.
Can you repeat that? I'm sorry.
Someone texts in reaction formation. Can you explain what that is?
Is that when you feel? Is that when you feel one way and you act another way?
It is. It is. You've got it. Pretend you're different is what the definition says. So what you do is you actually form a reaction different than how you feel. Okay, so you're forming a reaction different than how you actually feel. So if I get fired from work today, I come home and I spend all this money and take my kids and my wife out to an expensive restaurant. I have formed a reaction that is different than how I feel. Okay? You got it. Form a reaction. Okay? Denial, if you see denial on there, if it's one of the first choices, be careful about that because denial is kind of a big cover all for all of the defense mechanisms. If it's alcoholism or drug use, denial is almost always one of my defense mechanisms. But if that's the one on the test, make sure you're not seeing any other ones because denial many times is a broad-based cover for some of the other ones. Okay? Hold on one second, read that question. Intellectualization, you got it. So Jasmine explained intellectualization. Instead of identifying an event with your feelings, you identify with correct terminologies. My husband is dealing with a myocardial infraction. Yes, he's having a heart attack. So you use those terms. You got it. Instead of dealing with an emotional level. Another one of those is people with eating disorders. Many times they don't want to deal with the feelings of what they're dealing with, but they can research and justify exactly why it's okay to eat just 3 peas today. They intellectualize it. Okay. Anyone asking any more questions on those? Okay, let's go back to our questions then. These are the top 10. I don't think you need to spend time learning all 50 million of them. I think you can probably figure the rest of them out, but these are the top 10 that we usually see on the test. But there are a lot. Okay, so here we go. 104. So Charlene is the emergency room social worker in a hospital that serves a population that is racially, economically, and socioeconomically diverse. She is frequently consulted by doctors or nurses on cases in which domestic violence is suspected. Charlene notices that virtually all of the referrals are poor Latino or African American patients. Charlene is probably not being referred affluent white patients as possible victims of domestic violence. So we want to know why. 1, they are more empowered population and unlikely to be victims. 2, healthcare professionals may be biased against identifying domestic violence among the influenced white patients. 2, domestic violence among affluent white people takes the form of verbal, not physical abuse. And 4, affluent white victims of domestic violence go to their doctor's offices for care, not to their emergency room. What is the answer there? And again, rule out 2, and then go back to 2 that maybe you can't prove in the question, but you can prove in some knowledge. How come? So, what's the answer? Give me some chiming. I got a 2. And that is the correct answer. It is 2. It is 2. Absolutely right. Okay. Healthcare professionals may be biased against identifying domestic violence influence among affluent white patients. Are absolutely right. Got it. Good, good, good. Okay.
Would you say that number 4 could be a possibility too?
It could be a possibility, and there is some truth to that. I just don't know if it's the numbers are that high. But yes, that could be number 2.
So
sorry, number 4. But the answer is 2.
That's where I would kind of get stuck at between 2 and 4.
Okay.
Because
go ahead. Sorry. Yeah, there's just not enough research out there to say 4.
Okay.
Okay. So we do know that healthcare providers, we have a stigma, and even if you look at yourself, if you have patients come in and she's white middle class pulling up, we're probably not even going to ask her if she is a domestic violence survivor. She'll come in and say, I wrecked my car, and we're going to believe her. Or don't we all have some just our own biases against what we think a domestic survivor looks like?
Right.
Yeah, we do. Okay. Zach is a social worker on the HIV/AIDS clinic treatment team at a large urban hospital. He meets with Saul, an undocumented immigrant from Colombia who is HIV positive. Saul does seasonal work under the table for a landscaper. He has no health insurance and receives no public benefits for himself or his wife or children. Zach would like to help Saul apply for benefits according to the HIV status, anticipating that his HIV status might compromise his ability to work in the future. What initial referral should Zach suggest to Saul? A, refer him to the SSI for SSI income. 2, an immigration lawyer. 3, apply for food stamps and fuel assistance. Or 4, apply from Medicaid. 105, what's the answer? If you want to speak instead of chiming in, I'm okay with that.
Well, we know it's not 1 because
we know what that is, right?
65 plus.
Okay.
I say 2.
Why?
Because he's undocumented, so he's not going to be eligible for the other benefits.
You got it. Not only is he undocumented, he is not a citizen. So even if you have documentation and you're here on, a work visa, you're still not you still don't get assistance. You have to be an official citizen. So if he has children that were born here, they would qualify, but he would not. Okay. So despite all those myths running around that talk about how all the people come over and take all of our benefits, you have to be here legally or a citizen to get the benefits. Okay. Really clear on that? We hear that a lot. It's a really common myth. Okay, let's see here. I'm going to go. Okay, let's look at 112. This also kind of is an indirect, and I've seen these on there, and especially if you've never worked in this facility, you might not know. Okay. Bethany consults Lorraine, the Elder Services social worker, regarding her mother's eligibility for nursing home care under Medicaid. At 85, her mother is cognitively high functioning. She can no longer drive safe, but she can manage simple cooking and can wash and dress herself, taking her medications and ambulate with a cane. Bethany wants her mother to move to a nursing home because Bethany is moving out of the area and will no longer be as close to her mother's grocery shopping and drive her to the doctor. Lorraine informs Bethany that their mother is not a candidate for nursing home care. What response is not a factor in the social worker's assessment? Not a factor. 1. The nursing home admission under Medicaid requires the elderly cannot perform at least 3 ADLs. 2. Home-based services can be put in place to support the elderly staying at home. 3. Her mother would be among age peers in the nursing home, but not among peers in relationship to their functioning. Or 4. Nursing home care can be made available if relatives will not be made available if relatives can care for the elder. That is 112. What is that one?
Interest months not factor in social work assessment.
Okay.
One.
It's 4. And Jasmine, you answered that correctly. Jasmine, you want to share why?
Well, not really, but
well, thanks. How do you know that answer?
nursing home will not be made available if relatives can get. That's really not a factor because some people go into nursing homes even if their relatives can't care for them.
Exactly. It is not a factor. The other 3
So
are
that's our.
factors.
I mean, I guess nursing homes do assessments based on the other factors, and the last one does not apply.
Perfect. So whether you have people or not has nothing to do with whether a fact that the nursing home you would qualify. Okay, good. Thank you. Okay, so just some diagnosing here. We've got Dal. He's 11 years old and we have to repeat 5th grade due to frequent truancy. When he skips school, he hangs out downtown with his older brother's friends. Twice he's been picked up for shoplifting. When Dale attends school, he is usually quiet and somewhat uninterested in learning. In the school cafeteria, he bullies other children to give them their lunch money, chips, or dessert. Dale's parents have been called repeatedly about his truancy, but seem either unable to control him or uncommitted in trying. What diagnosis does Dale's behavior suggest? See opposition defiant, antisocial, bipolar 1, or conduct disorder. Chime in for me, guys. Rule out 2 and tell me the other 2.
One.
Got a 4. You got it. It is 4. It is 4. Okay. And the rationale, let me pull that up, is okay. So he is conduct disorder. What makes conduct disorder different than opposition defiant disorder?
His age?
Not necessarily. Nope. Conduct and opposition defiant disorder both have to be diagnosed before the age of 12.
And this is this according to the new DMS-5, right?
It is. It sure is. They both have to be diagnosed before the age of 12. So the difference between ODD and conduct disorder, stealing, yes. Okay, you got it, stealing. So the difference is my conduct disorders, what I look for is intent. Okay, my opposition defiant kids, they may throw a table, but they're not throwing it to hurt you. They're disobedient, they don't want to follow the rules, they're sometimes mad at the world. Those are my opposition defiant kids. Okay, but my conduct disorder kids are mean. Their intent is to hurt you. Most often, they're my fire setters. They're my kids who will be my future antisocial kids. Okay, so I always look at intent. Intent. He was picked up for shoplifting. He broke their laws. That's a big one for my conduct disorder. He bullies other children to get their lunch money, and it's just mean. Okay, so he's in conduct disorder. If he was mad at the teacher and just kind of picked up something, I wouldn't be as worried, but this is a big deal. My bipolar 1, does anybody know what that one is as opposed to regular bipolar?
I believe
bipolar 1 has, one of them has a mood with it.
So bipolar in general means moods. So
Oh.
what mood?
Depressive?
Go ahead, try again.
Do they experience mania in manic at the same time?
So it depends on how high the highs are and how low the lows are. Okay, if you can see. Okay, so I look at bipolar 1. That's my kind of my purple. My bipolar 1, we see that. Okay, the high, the high, the high. That's my mania. That's my bipolar 1. So I've got these really big areas of mania. My bipolar 2s, they have less mania and more of the depression. It's my darker purple right there. More of the depression. They have some mania, but more of the depression. Okay. And then I see my cyclothymia. I always call that baby bipolar. And a client once said to me, do babies get bipolar? So that is not true. It's just a smaller version of bipolar, cyclothymia. So you kind of have your ups, your downs. You're not over. The difference of cyclothymia, it's kind of just long lasting. It keeps going. Like you always feel ups and downs, but not major mood swings. And you see my green is my average. So all of us have up and down days. All of us do. Okay. My bipolar 1 has more manic episodes than my bipolar 2. Okay. So whether it's bipolar 1, bipolar 2, or cyclothymia, what is the medication of choice?
Lithium.
Yes, you got it. And
do you mind
lithium.
repeating that?
Which part? All of it?
The lithium is typically used for
any of the bipolar disorders. Those are called affective disorders. Okay, so you might see that term, and yes, we kind of think of our affect as the way you look, the look on your face, but affective disorders are mood disorders.
Okay.
Okay, so those are in general on my mood disorders. I'm talking about seasonal affective disorder. So affective disorder are mood disorders. So if you see that, you're like, what is that? That's not my affect, that is my mood disorder. I'll put this little video in there in the slideshow. You can go watch it if you want. But it really is just about my moods. Affective are mood disorders. So, that one. Yeah, I'll just put that in the chat box. Okay. So when it comes to mood disorders, those are, again, that's my bipolar, my depression, any of those are mood disorders. Depression, major depression, dysthymia. Dysthymia is now called pervasive disorder, pervasive depressive disorder. That's what that's called now. That used to be called dysthymia. Okay. And in general, those are all affective disorders. They affect my mood. Those are mood disorders. Schizoaffective is another mood disorder. The difference between schizoaffective and bipolar is that my schizoaffective people have more of a psychotic piece than my bipolar people. Okay. Dysthymia is still on the test. Thank you. Thank you. Okay. So what she said was dysthymia is still on the test. So as I refer to bipolar, cyclothymia is baby bipolar. Dysthymia is kind of baby depression. So they're both kind of have longer lasting times. However, the moods are just not so big as the depression or as well as the bipolar disorder. So dysthymia is on the test. Thanks for that, Jasmine. Okay. Let's see here. Antisocial personality disorders. Please remember that they are not just unfriendly, they're anti-people. They will eat you. They will eat you, eat you, eat you, and blame you. Okay. 114. In the first interview with a new client, a social worker explains the purpose of their meeting to the client, the risk and the alternatives to service, confidentiality and its limits, and the cost of the services. This is known as providing what? Duty to warn, informed consent, an intake interview, or self-determination. 114. That is my informed consent. All of that needs to be in there. Okay, I cannot just give them a pamphlet and say, here, read this. All of that has to be in there. That is my informed consent. Good job. Thanks. Okay. Number 115, Jane is a child services worker in the foster care unit. In her first interview with Rainey, a foster mother, she asked Rainey on a scale from 1 to 10. One second. Sorry. To evaluate how difficult it is to set limits for limits on Debbie, a foster child who tests the rules and is hard to control. The goal of their work together is to improve Rainey's ability to set limits with Debbie. Jane asked Rainey to rate her ability to limit set in the final session as well as and uses this as a measurement of the program. The method of outcome in this evaluation. Okay, so what is she looking for? Sessional contracting, generalization, single subject design, or sessional ending. Sessional ending, 115. What is that? Waiting for a chime. Take your time. Somebody give me a chime before I give an answer. Okay, I have a 3. You are correct. That's a single subject design. How come, Rachel?
Well, it was a guess, but it felt like the numeral factor to it, and just to rate one thing, and that's how difficult it is to set limits. But that was my best guess.
That is correct. It's a single subject design. Okay, you're absolutely correct. So that is when I do an intervention. Okay.
Is it possible you can explain why it wasn't the other two with the sessional ending and contracting?
I can. 1 second. Okay. So we just talk about single subject design. Let me go with that first. Okay, so my single subject design is taking a baseline, coming back, implementing. Okay, so that is what that looks like. So the best question is the best type is AB, AB, AB. Okay, so that's what that is, the single subject design. Okay, so baseline, adding attention, baseline, adding attention. Okay, so then let's go back. Okay, so contracting, what is contracting?
It's making an agreement.
Okay, so then, so there's what do you see in there? It says contracting.
I guess I'm looking at sessional. That's probably what is throwing me off.
Okay.
Right.
So, okay. So that is, there's nothing in there that talks about contracting the session. We wouldn't contract for one session anyway. We would contract for a group of sessions, usually not just for one. Okay, can't be generalized. So what is the single system design? And she took a baseline, she added the intervention. What was the intervention she added? Anybody? Yeah, you got it. You got it. Okay. 116. Dinah, age 13, is talking to a school social worker, Dawn, about being teased in school. Dana brought by bus to an affluent suburb a half hour from any city neighborhood. Her family cannot afford the clothes and accessories that help her blend in with the other girls. And Dinah's mother thinks those are nonsense anyway. So Dawn asks, what is it like for you when your mother says this stuff is nonsense? Dawn's intervention is an example of what? Is it an open-ended question, a mirroring, or a closed session question or underlying? What is that? I got a 1. Got a 1. That is correct. That is correct. Open-ended question. Perfect. Okay. Medication issue. At a first interview with a social worker, Jonah, in a multidisciplinary family service agency, Margaret describes herself as miserable almost every day. She's been going through a bitter divorce for the last year and fears it will continue to drag on, sapping her energy, preoccupying her during the day, and keeping her awake at night. By the fourth interview, Jonah referred Margaret for a medical evaluation. And 2 days ago, she began an SSRI antidepressant. Margaret says that she hopes the medication will help because she feels worse now and can barely drag herself out of bed in the morning. Has to force herself to eat. She expresses no suicidal thoughts. Over the first weeks, Jonah suggests that they meet twice a week for additional support. What reason for this suggestion should Jonah have in mind? And one SSI medications typically take a few weeks to be useful to clients. 2, the social worker has to be concerned about Margaret's general health status. And 3, Margaret is not suicidal now. Or 4, Margaret needs a reason to leave home to reduce her depression and inactivity. So 117. What is the answer to that? I got a 1. Any more? The answer is 1. You were correct. SSR medications typically take a few weeks to be useful for clients. So during the time, Margaret may need some intense support talk therapy. Okay. So give me some examples of my SSRIs.
Prozac.
You got it. You got it. Okay. Lexapro. You got it. You got it. 18. 118. Okay. Okay. I'm gonna let you guys read that one and figure that one out just for a second. I can let my drink some water here. So go ahead and take a few minutes and read that one and chime in your answer. Yes, Jasmine. You don't have to read out loud. You can just read it to yourself for a minute, okay? I'm just going to drink some water. Wait, okay, Jasmine, what was your question again? I missed that. Can you just ask me your question?
I had a lot of screaming in the background from the kids.
Okay.
What is a quick fix for depression medication? Is there a medication for quick fix?
There's not. They all take about 2 weeks to increase your levels.
Oh, okay.
There's not a quick fix. It's an increase of your serotonin. That's what makes it SSRI. Got it?
Got it.
Anybody want to answer?
I'm ruling out 2 and 3 and between 1 and 4.
Okay. So then what in the question would help you prove that? Okay, so why are you ruling out 3?
Let me see. Well, not anymore.
Okay. Be brave and think out loud.
Okay, so it seems like he's clarifying on number 1. On the one hand, you say college is the only good option for your future. On the other hand, you seem to feel school is a bad place for you to be. I would need to look back on the question to check that.
Okay.
2, ruling out. 3, it seems you usually choose to do things you don't like, then you don't work at them and turn out badly. That's also true, but it seems like there could be a more, I guess, a lighter way to say it to her. And then 4 is it must be very confusing for you to figure all this out. That seemed, like pretty supportive of the client. Yeah. But it might not be the most useful, or it might be.
I got a 3. I got a 3. Yeah, the correct answer is 3. Okay. And Rachel, thank you for thinking out loud. I really appreciate that.
Yeah,
okay. So, yeah. Have you considered a trial separation? Okay. Good, good.
Wait, so I just want to understand why it was 3.
Okay, so let's rule out. What does the question ask me?
So, what is Pat's most useful intervention, or to say?
Okay, so we can look at tell me the scenario. What's the problem?
So she doesn't like school. She doesn't want to do the work. She also doesn't like the series of jobs that she's gotten.
Okay.
She would feel good at them. Even something that appeals to her, she doesn't want to do.
Okay. So then, if we look at 3, this intervention would not be consistent with a client's goal of feeling less unhappy in the marriage and should engender hope for positive change. Answers
what about the marriage? Where does it say about marriage?
So okay, so how do you have you considered a trial separation? Let's go back. So
wait,
Diane,
are we on 119?
118.
Oh, I was reading the wrong question.
Are we on 118? Yes. Everybody else?
I was on 119.
Okay, we're good then. Okay. 119. The answer is 1 on 119. Okay.
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 Sorry.
No, you're good. You're good. You're good. Okay, let's do. I'm looking for some kind of. Looking for some first last questions, some of those. So give me a second. Let's look at this one. These come up sometimes, those communication questions. 139. Logan is a social worker in the medical surgical unit of a hospital. Mr. Ricci is medically ready for discharge after a surgery for hip replacement. Medically, Mr. Ricci would benefit from a period of rehabilitation before going home. However, discharge plans are complicated by his eagerness to return home to his post-stroke wife, who is temporarily staying at their daughter's house. Logan meets with Mr. Ricci and says, Dr. Manju asked me to help you with planning for your discharge and needs for aftercare. I understand your wife's care is also a pressing need, and I'm wondering if I might help you think through all your options and identify resources to meet your needs and those of your family. The introductory statement about the social worker is a step toward what? What's he trying to do? Clarify the worker's role in contracting for service. 2, summarizing. 3, enabling. 4, empowering. $140. I get some terms in there. I got a 1. I got a 1. What is 1? 1 is clarifying the worker's role in contracting the service. So he made clear that the person knew what they were doing, what he was sharing. So that a question, Jasmine? I think it's a question or a statement. I'm not sure. But so he was sharing what the social worker, what his job was. Okay. And the correct answer is 1. It's 139. He was just telling him what he does. Okay. So he knows what to expect, what's happening. Okay. Let's see here. Okay. Let's look at 142. Lena leads a group for women who are childhood trauma survivors. Lena finds it hard to stop thinking about the group discussion when she leaves for work during the day, and sometimes she has upsetting dreams that seem connected to her clients' experiences. Lena's boyfriend comments that she's been a little jumpy these days, and she notices that she is less comfortable being alone than usual. Lena's reaction to leading this group is called A, positive countertransference, 2, reaction formation, 3, vicarious traumatization, or 4, professional impact. What is that? 142. I got a beep. I got one beep. Hold on 1 second. I'm trying to get someone to invite them in. 1 second. Sorry, I had someone who wanted to join and didn't have the link. I'm just trying to send it to them. I know it's late, but let me just. Plus, I only have one brain cell. So anybody want to talk for me and kind of share what their thoughts are on this one?
Well, I ruled out 1 and 2, and I was between 3 and 4 because vicarious traumatization sounds like it could be an option, but also professional impact also sounds like it could be an option too, but I went with 3.
3 is absolutely correct. So vicarious traumatization, what would that absolutely mean? Anybody want to share? Or Rachel, do you know?
Well, you're experience part of their trauma through their story, connected to them, and that has an impact on you.
Mm-hmm. Okay. So in general, when it comes to vicarious, that word just means kind of like living through others, things like that. That's what that means. Okay. So then that is vicarious trauma. Was there a question there that I missed? Hold on, something popped up. Was there a question? I have heard of countertransference, but never positive. Okay, so that's a pretty new term also. So now we have like a positive and a negative countertransference. Has anyone else incurred those things? Those are newer terms. Well, look at that. Hold on one second. So as a rule, transference, of course, we know is the feelings that we bring into the relationship. Okay, let's try that. Okay, and then just in general, they can be positive or negative. Go back to here. Okay, so negative countertransference is also present in punitive actions or attitudes towards the participant, which result in the detriment to the interpersonal relationship and to the team's clinical functioning. Positive countertransference can have equally detrimental effect, often manage stuff and over solicitous acts and participation. So positive is when I really, really, really like the person, and negatives when I really, really don't like the person. Okay, so that's positive and negative transference. Okay. So there are those two things, a good and a bad of transference. Freud would have said they're neither good nor bad, they just are. Okay, but that's what that means, positive and negative transference. Okay, gotcha. Okay, let's look at some. I'm trying to find some more of that. Okay, let's look at 146. Mara is a social worker for a program that serves Holocaust survivors, providing clinical casework services to them and their families. From her practice observations, Mara is developing ideas about resilience that she thinks could contribute to the current theory about coping with trauma. The approach to theory building is called A. Single system research design, 2. Population observation, 3. Grounded theory, 4. Force field analysis. What is that? I'll give you a moment to think about that. I got some answers there. What did I get? Yes, yes, yes. One or two, one or two. Okay, so the answer is 3. Anybody know what grounded theory is? Grounded theory is a method of theory building in which observations from life in natural or client settings are used for the development of testing theories. Okay, so it is grounded theory, is really on the ground theory. Like I'm in here, I'm watching it, this is what I see happen, and I've come up with this theory, on the ground theory. Okay, thoughts? On the ground theory. Okay, good. Okie dokie, let's see here. So we're gonna do, trying to find some, let's go, let's go. Okay, let's look at 149. Jasmine is receiving in-home parenting support service through the state Child Protective Service Agency. Her social worker, Alexa, observes that Jasmine's 2 preschoolers demand sweet snacks and soda from Jasmine shortly after lunch. After saying no a couple of times, Jasmine gives in, handing them cookies and cupcakes while saying, "Now, are you satisfied? Just stop your whining." Using a behavioral approach to getting the children to stop demanding sweets before lunch, how should Alexis handle a situation? Okay. Yes, Jasmine, is this you? So funny. She keeps telling children to wait for lunch until they can give up trying to get sweets. Jasmine should give each of them a snack and a soda with affectionate comment instead of making a negative one. Jasmine should ignore the children's personal demands, or Jasmine should feed them lunch earlier. Okay. I got a B, I got a B. That's what I got. That's from Jasmine. Jasmine, the answer to that one is 3. From a behavioral approach. So which one of those is a behavioral answer?
Okay.
Anybody? Bit 3, okay, that's the behavioral choice. Ignoring is an option. Do I say something? Ignoring, yes. Ignoring is something we do. Okay, so every time they say no, 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 and yet you still give in, you're giving them something. Okay. Okay, let's pick another set of those. I'm just going to kind of go over. Actually, I'm going to do a little bit of pocket prep. Okay. Everybody use pocket prep usually?
Mm-hmm.
Okay, and sometimes I narrow it down. Today I'm not. We're just going to see where we go. Okay. A 5-year-old child cries when his parents drag him off at school, and he constantly asks his teacher, when will he see his parents again? Which of the following diagnoses the child most likely exhibiting? Panic disorder, conduct disorder, adjustment disorder, or separation anxiety disorder? Everybody, come on.
A lot of us said D.
Which of the following identifies when a social worker can ethically restrict a client's self-determination? When can I do that? When can I actually restrict my client's self-determination? What was the previous answer? I forwarded that one. Self-separation anxiety disorder. Okay. Somebody needs to mute, it sounds like. Okay, so now on the second one, which of the following identifies when a social worker can ethically restrict a client's self-determination? This is a code of ethics question. Was that a D, somebody?
Mm-hmm.
You got it. Next. A family arrives at your office for therapy. The parent appears to have a rigid control over the children, who seem to be following strict behavioral rules. As therapy progresses, you will find that the children have low self-esteem and do not seem to be very happy. So they are not in behavioral trouble at school and are good academic performers. Which of the following parenting style matches the circumstances? Involved, authoritative, authoritarian, or permissive? Okay. Which of the best is? I got a C. Okay. Tative or talkative? Those are my best parentings, the talking parents. Tative is talkative. Authoritarian is I'm making all the decisions, which is fine when they're 2, 3, and 4, but when they're older, they get some say-so. Okay. Which of the following is not a focus of the Child Abuse Prevention and Treatment Act of 1974? Not a focus. Not a focus. Ching, ching, ching. Somebody, not a focus. Okay, Child Abuse and Child Abuse Treatment Act of 1974. Grant money, federal support for family reunification, federal support for prosecutors, or federal support for assessment programs. That is when we gave money to family reunification. We truly believe that biological families belong together. And that is our goal, is to reunify patients, to reunify our clients, get them back together. Okay, so that is what we do, is we do family reunification. Okay. Which of the following would be the most important element to consider prior to contacting a client's collateral resources for information to contribute to an initial assessment? Remember, my collaterals, those are the people who can kind of vouch for me, my doctor, my neighbor, any of those people. Okay. What would be the most important? Remember, a most means there's probably more than one correct answer, but which would be the most important? Come on, take a stab at it. Most important.
Is it A?
So let's see here. It is B. I'll show the explanation. Okay. It is the most important. Okay. Oh, I did not mean to submit. Okay, let's go back. Let's pick a few more of those up. Okay. A client behaves in a way that is opposite of his or her original unconscious trait. Which of the following defense mechanisms is the client using? Reaction formation, sublimation, displacement, or projection? Which one?
A.
A? Got it. The psychoanalytic theory suggests that neurosis is characterized by which of the following? Neurosis. It's a Freudian theory. What would Freud say?
A.
Got it, Madman. Internal conflict. You got it. A client pretends that she is Jennifer Aniston because Jennifer is beautiful and never seems to have any problems in life. What type of defense mechanism is she most likely using? That'd be idolization. She thinks she's amazing. Yes, yes. Okay. A client feels that everyone thinks she's a slow learner, so she spends extra time making sure everything she does is correct before he shows anything. What defense mechanism is this one?
A.
Compensation? Got it. A client has trouble walking and cannot keep up with her friends when they're shopping, so she always buys them lunch and gifts makes up for her disability. This one is overcompensation. Okay. The parent of a 4-year-old has been referred to the social worker because they have not been able to successfully toilet train their child. Specialists have not found anything physically wrong with the child to prevent him from being toilet trained. During the session, with the social worker, the parents also reveal the child sleeps with them. They have been very unsuccessful in getting him to sleep in his own bedroom. During the initial assessment, what's the most important thing for me to focus on? The initial assessment. A, B, C, or D. Initial.
A.
A. Perfect. Clients use a number of defense mechanisms in order to protect themselves during treatment. What's the best defense mechanism? Which of the following best describes the defense mechanism rationalism? A, B, C, D, or A, B, C, or D? Rationalization. That was a C. Gotcha. Okay. Which of the following has the least clear definition? Race, ethnicity, cultural identity, and nationality? This one is race. We've talked about this a little bit before, that people always get confused about what race means. Okay. Which of the following is not a stage in the achievement of the ethnic identity? Does everyone know those stages? Those are by Williams, Robert Williams. He was one of the first people who looked at culture when it comes to in the field of psychology. Do you know those stages?
No.
No, well, let me show you those stages. Those are our racial identity stages. He talks about many of the other races, how they develop. However, most often on the test, all I've really seen is about how Black people develop. Okay, I'm going to put this link in the chat box. So you know in general that when we came to the studies and most of our psychologists, they really did not look at any cultural differences, and that was mainly because of the makeup of the time. But when we look at how people identify, and again, I've not seen the test discuss anything but people of color. So first thing is pre-encounter. And so what happens is as we are kind of getting to grow up, especially I gave an example of my children. My children, we grew up in a predominantly white neighborhood. So they really kind of believed what the majority culture believed. His example is that white is right and Black is wrong. You de-emphasize your own racial group. At that point, you just kind of want to blend in. Encounter is then when you have an encounter with someone or an instance where you realize that you're of a different race. My older son, you'd go and hang out at the Walmart at midnight with all of his friends who are not of color. And when he got a hard time, and they gave him a hard time, and he didn't, that was probably his first encounter where he realized that he did not look like many of his friends. Okay, immersion. That's when you really kind of try to surround yourself with symbols of your Black identity or whatever racial identity you are. You're trying to realize that, hey, wait a minute, I'm going to immerse my Blackness, immerse my whatever your nationality is, and be proud of it. 4 is your internalization. You internalize it. Many times you get the pro-Black attitude. I'll say with my older children, my daughter decided that she would wear her hair naturally because she was Black and she was proud, and that's kind of who she was. So then we're making a commitment to internalization, and that is that we really realize that who we are based on our culture, our ethnicity, our race, and then kind of live our lives in the world based on our difference, our view of ourselves. Okay. So I sent you the link. It does talk about biracial people and white people as well. I've just never seen anything on the test regarding anything of the others. We've talked about many of these terms a couple of times. So assimilation, as similar as. So assimilation is when I lose my own culture. I value the majority culture over my own. Separation is when I actually am trying to keep my own culture while withdrawing from the other culture, from the minority culture. Marginalization, we know that. That's kind of people who are kind of on the outside. They don't kind of fit in the majority culture. And integration, of course, is how we integrate that into who we are. So accommodation is when we add a culture to our culture. Assimilation is when we look as similar to the majority culture. So whether it's Black, white, or wherever the majority is where you live, that is the way that it works. Okay, and again, I've only seen questions on this about people of color. I haven't seen any on the test, or I haven't heard anything regarding people of different color. Okay, so that's my racial identity. That's those stages. Okay, so which is not a stage? Okay, and that would be reproachment. Anybody know who that belongs to? Guesses. Who would say reproachment? And the crowd is silent. I got a name. I got a name. That would be Margaret Mailer. She is one of my. She's one of my. Oh, this one. Well, M-A-H, Margaret Mailer. Okay, she is one of my theorists that looked at attachment. That is Margaret Mailer. Okay, and what she said was that we have these different levels of attachment. Oh, I'm not gonna share that. Sorry. Trying to close out some windows, guys. Got tons of windows open. She said that we had a normal autistic stage. Okay, she said we had a normal symbiotic stage, separation, and then hatching, practicing rapprochement. Rapprochement went going back, coming forward, coming back, coming forward, coming back, coming forward. That is rapprochement. So Margaret Mailer is one of our biggies when it comes to attachment theory. So she is in the, I was kind of say the APGAR book. So yeah, she is one that you would need to know. My big attachment people are Bowlby, they are Mailer, and Ainsworth. And those focus on attachment. Okay. Okay. So a foster parent asks a social worker who is treating his or her 15-year-old foster child if the social worker knows if the child is using narcotics. Which of the following represents what the social worker should do first? What should we do first?
D.
Got it. You got it. Okay. A client asks a social worker to give another client a small present. The client informs the social worker that they were both in the same foster care for several months, and the client's birthday is next week. What do we do? Can I explain? Go back to that one? I sure can. Okay. So that one is just confidential information. Okay. So all I can say is, even if it's a foster care, all I can just say is that I'm sorry I can't share that with you. So the state is the parent for that child. So even though the foster care does have the rights to take care of them, the state is the parent. And for the record, the state is the parent for everybody's children. Okay, so yes, we can raise our children, but that's what gives the state to come in and the right to take our children if we're not doing what we're supposed to be doing. So the state is actually the owner of all of your children. I know that. So we can look at it that way, but the goal is just that it's because it's not the child is your client, your foster care worker. The child is your client, and you cannot break that confidentiality. Okay, does that make sense? If it said if it was parents, it would still depend on who my client is. Okay, so if the 15-year-old is my client, then confidentiality still withholds, even if mom and dad are paying for it. The only time I break confidentiality is if the client is in imminent danger and using drugs, especially if it's just smoking pot. I can't think of any drug that put him in imminent danger. So that is not viewed as imminent danger. So I would not share that. Okay. I would say, we try to, of course, work with the child to get him to understand that maybe you should tell his parents. I try to get the parents in session, but no, that is not imminent danger. I think I see that question also. If the girl is 15 and she's pregnant, I can't share that either. She is not in imminent danger. So imminent danger of hurting herself or someone else, that's the reason, the only time that I can actually share that. Okay. So it depends on who my client is. Now remember, if the family was coming to a client, the family is seen as a whole unit, and then that would go back to the family, and we would discuss it in the family union. But at this point, it is the child is the client. So it always matters is who is the client. Hope that helped. Okay. This one, just you tell her you can't accept a gift. So it was a former foster care child and she knew each other. That's a violation of HIPAA to even acknowledge the fact that the child is still in foster care. So you just say, sorry, I can't do that. Okay. Let's skip this one. A client is in meeting with the same social worker for the past 5 years to deal with her childhood abuse. During her scheduled appointments, the client would bring homemade snacks to the office for the office staff. During today's appointments, the client brought her social worker a new designer purse for all of her help during the past 5 years. Okay. This is not what I would do. This is the ethical decision because I would say thank you for the purse and keep going. Hey, really appreciate it. I'm joking. I wouldn't do that. So what do you do? Depends on if it were a coach, then maybe. Come on. What do you do? Got it. Got it. Okay. A client reports an affair with her social worker while she was a client. What should the social worker manager do? What do you do? Report the social worker to the appropriate board. Is that what I do first? And it doesn't say first, but let's assume, you just found out. What would you do first? See, I'm going to ask. I'm going to assess. I'm going to ask. I'm going to ask. Okay. I know clients lie, right? He may lie too, or she may lie too. But before I do anything, I'm going to assess. I'm going to definitely assess. Okay. So even in this case, so we've talked about a little bit, maybe not about the hierarchy of the hierarchy. So the indirect approach looks at the hierarchy and how we go up the level. So even if I had thought a colleague was having a client reported that, if I were just the regular clinician, I would still go up the ladder. I would go to my supervisor, let my supervisor handle it, someone above my pay grade, let them handle it. Then I might take it to the board. However, if there's something inappropriate going on, I actually take it to that colleague first. Okay. So then I would just kind of take it up the board, take it up the chain of command, or we just discuss it with the client. Okay. But I'm not calling the board, not first. During a utilization phone call, talk about that before a little bit. Utilization people are the insurance company. Most often you've signed a release saying that they are acknowledging to pay for your visits. During a utilization phone call, a social worker is asked to release specific details the client experienced as a rape victim. What should the social worker do first? That was a C. You got it. Okay. And because most often they've signed the release first. So I really, I like the insurance to pay for my visits. So we're going to make sure they've got that release signed before we do anything. Okay, guys, it is time for me to wrap it up. I'm going to ask you in general, I'm going to turn this off and there'll be a recording at the end, so no worries. But I'm going to ask you, do you have any questions for me? Anything that I can ask of you? I can clarify anything? Turn my camera back on. I'm going to stop. Camera back on. You should be able to see me. Can you see me now? Yes. Yep. Okay. Questions? Did you find today helpful?
Yes, very. Thank you.
Okay. Okie dokie. So I'll do next Sunday the same time from 6 to 8. If you have anything particular that you want me to discuss, any questions you want, be sure to just paste it on my Facebook page. I'll gladly do that. Anything at all. So I do this all day, every day. So I just really enjoy making sure that you reach your journeys. I do all full individual sessions. My individual sessions are 25. They'll go up in January. So just so you know that. They're 25 an hour for now. Okay. Other questions? It's been a pleasure, guys. Good luck. Being such great world changers. Bye.